Estrogen is often known as the female hormone, but it goes far beyond periods and pregnancy. It touches literally everything in our body, from our brain, our heart, our mood, our bones, and our nervous system. Today, we're going to break down exactly how estrogen works. The first thing on my list is the nervous system and the brain. Estrogen is very, very important in our memory, our cognitive function. It helps with neuroplasticity in our brain. So when we're low in estrogen, our cognitive issues can start to decline. We can start seeing some memory issues where it's like we walk into another room and it's like, why did we come in here? We also have trouble recalling words. This is why ladies who are going through menopause will have like this brain fog. If you're like sitting there in mid-sentence, you're just like, what was I talking about? All that can be because of low estrogen. Also, depression, anxiety is another prime example of low estrogen. Estrogen also boosts our serotonin and our dopamine, our happy hormones. So when we have that little dip during our menstrual cycle, that is because it's messing with our dopamine and our serotonin, and we can have just kind of all kinds of mood swings. So when we go into perimenopause or menopause, it really is taking a dip, and it really can have a huge effect on our serotonin, on our dopamine. I am here to tell you, I know they say it's just all this process of aging, but it's not. We should not be having these huge dips in our estrogen. A dip in estrogen also can cause neurodegenerative diseases such as Alzheimer's or even dementia. So when you start to see older ladies who are having these cognitive issues such as dementia or Alzheimer's, that can be because of the cause of lower estrogen. So I'm going to talk a little bit about what estrogen needs in order for it to function in our nervous system. Vitamin B6 is one of those things. B6 plays a huge role into production of serotonin and dopamine. Magnesium is another one that estrogen needs in order for it to make the nervous system function properly. And omega-3 fatty acids is another one that we need for our cognition and to make estrogen do its best. Number 2, our bone and muscle health. Estrogen plays a huge role in helping us to maintain our muscle mass and also muscle recovery after we've had a workout. It also helps us to balance out our insulin, which is responsible for energy production. Estrogen also helps us to protect our bones and build strong bones and to utilize calcium. A lot of people have the misconception that if we have osteoporosis, that means that we don't have enough calcium, when in fact it's because our estrogen is taking a dip and it's not able to utilize the calcium that we already have, and it's not able to absorb the calcium into the bones. Very, very important to have estrogen so that we can have stronger bones. So what does it need in order for it to function properly? Estrogen needs vitamin D. It helps to absorb calcium into our body. So if we don't have enough vitamin D3 in our body, we're not going to be able to utilize calcium. We also need magnesium. Again, that is something that we need for our nervous system and also our bone health. Number 3 is heart health. A lot of women, as we get older, we're more subject to having heart disease than our male counterparts. That is because our estrogen is taking a dip, which affects our heart, which is a muscle. Estrogen is a huge heart protector. It helps to relax our vessels in our heart. It improves circulation. It helps to regulate cholesterol, and it helps to improve inflammation in our body. We need our magnesium, we need potassium, we need CoQ10, and vitamin E. The next one is our reproductive system. Estrogen plays a huge role in ovulation, our menstrual cycle, and to thicken up the uterine lining so that we can hold baby in there. Estrogen is produced in the ovaries, but it's also produced in the fat cells in the adrenal glands. So that's why some women, once they have the little ovaries yanked out, they are still able to produce estrogen through their adrenal glands. However, if your adrenal glands are fried, then yeah, we're not going to see a whole lot of estrogen. Estrogen needs all your B vitamins, your zinc, and your choline in order for it to function properly within your reproductive system. Once we're older, our estrogen starts to dip and it's harder for us to get pregnant. And doctors say that we are more likely to have miscarriages if you're over the age of 35. We're trying to conceive that we are increasing our zinc, all of our B vitamins, and choline. So the next section, I want to talk about postpartum and postpartum anxiety and depression. Now, I had postpartum anxiety where I was just having these unrealistic fears that something horrible, terrible is going to happen to my child, like leaving him in the dryer. For some odd reason, that was a fear of mine. But once we have our baby, our hormones start to fluctuate. So ladies who are experiencing these depression or postpartum anxiety after they have given birth is because our estrogen is taking too big of a dip, and we start to have just these crazy mood swings, and we just start having unrealistic fears and just thoughts of just horrible things. And that's why we're having those, is because our estrogen is taking too much of a dip. And the way that I was able to combat that was what I just mentioned just a little bit ago, with taking the zinc, the choline, and all of your B vitamins, magnesium, all the things that I'm talking about, the supplements. These are very, very important key things to help you to maintain a better level of estrogen. Now, before you start taking the supplements, you do need to have a talk with your healthcare provider. What works for me may not work for you, but I like to use a little bit of common sense that we know that we need these things, and you want to make sure you're getting them from a reputable dealer. I like standard process. I do believe that you, however, have to go through a practitioner to get some of these supplements, but I also like pure encapsulation supplements. I also did some Mary Ruth's stuff, and I believe the Garden of Life was another one that I had looked into and was taking. So there are some resources out there for you to take to help you to maintain your estrogen. But again, do your own research and talk to your own healthcare provider. All right, you guys, if this is content that you guys enjoy watching, please consider subscribing to my channel to show me some support. And I will see you guys in the next video. Bye.